Hey everyone. Okay, so today I'm going to be talking about the spinal facet joints. Okay, in particular the spinal articulating facet joints. Okay, so first of all, what does that mean? So what is facet? So facet comes from the French word meaning face, which basically means flat surface, I'm assuming. So when two facet joints come together and they articulate or move with each other, basically they're just like kissing. It's like two flat surfaces on the spine. Okay, so in our spine, handy dandy spine here. In our spine, we have different areas, right? Sorry, this part's like twisted weird, but basically you have your sacrum at the bottom, right? And then you have your backwards lumbar vertebrae. There we go. Then you have the lumbar vertebrae, right? 5 of those. Okay, then you have your thoracic, 12 of those in the middle, right? And at the very top, you have your cervical, so you have 7, okay? And each of these different areas, the cervical, the thoracic, and the lumbar, have what's called articulating facet joints. Okay, also called Z joints or zygapophyseal joints. Okay, all that means, and all those are basically flat surfaces where two bones move with each other. So in our spine, obviously, if you take 2 in the cervical spine, say we take these 2 vertebrae right here. Okay, so as you flex forward the cervical, so this is like I was looking like this on my body, right? So as I flex my head down like this, these are 2 of the bones that are slightly going like that and moving forward, right? Together, all of them move and they do this forward flexion motion like this, right? So as a whole, we talk about spinal motions like you were doing cervical flexion. So the whole cervical spine is going forward like that, or like I did this. That, right? That's all happening together. But individually, each of the bones are also producing that same little bit of motion that together cumulatively makes that large spinal motion, okay? So to allow that motion between 2 bones, basically you have to have the ability to move and articulate. So the 2 spots where that happens, well, the 3 spots, but the 2 names for the spots are between each vertebrae. You have the bodies, which is this big part here, right, on each one. And between, you can see a little disc, okay? So a little plastic, little plastic disc. Okay, so that's those are our discs between our vertebrae, okay? And those are filled with, oftentimes it's described like a jelly-like substance, donut-like substance that moves around and they compress, right? So when you sleep, when you wake up, you're taller because the discs have basically have a higher water concentration, and so they've expanded, so you're actually taller, your spine's longer, slightly. Okay, but that's one of the areas of articulation. So when I flex forward and I do this, forward with my head, that little disc right there you can see between the bodies is compressing on the front. Kind of can see that, like that. But the other spot you can see is right here, there and there. So as I flex forward, if we can do the view like this on the side, as I flex forward, you can see these guys here are articulating just a little bit, okay? So that and that are the, what's called the articular facet joints. Okay, so the flat face, you can see if I zoom in here, is that flat thing right there. That's the superior articular facet of this spinal vertebrae. And on the bottom part of that vertebrae, there is an inferior, what you can see right there, articular facet. So every vertebrae has a superior and inferior, well, not everyone, most of them have a superior and inferior articular facet, okay, where they articulate. And each of the facet directions, you can think these flat faces, if the flat faces are like this, they're going to allow a certain amount of motion between the vertebrae here and the vertebrae above. If the facet is angled like this, that's going to allow a different motion. Okay, so each of the facets, I'm going to go through it here, each of the 3 areas of the spine, the direction of those flat faces is different, which allows, in our, say, thoracic spine, the flat faces are very much like this. So they're like, my back would be like, they're like that, flat, which allows the vertebrae above to slide like this above it, which allows rotation. And what do we do in our thoracic spine is you rotate. There's not a lot of, if we're looking from the side of the body like this, if you have a facet like this, which is the same as that, right? And then one above, it doesn't allow extension, it hits. But I'll show you that in a second. Okay, so let's go, let's actually start the lumbar spine. If I grab 2 vertebrae, okay, like this, okay, Here's two vertebrae. Here's the lumbar. Okay, here's the sacrum underneath. Okay, so if we have, I guess I got three here. Okay, even better. So there's the front, the disc, very articulating, and then you can see here, there's the facet joints. If we look from the back, right, these are spinous processes. You'd feel it in your own spine, right? Here is the facet joints. So you can see it shows it pretty good in this model. You can see how they're kind of angled more, that's a good view, these guys. They're kind of angled more medial, right? And then lateral for the one here, but the one below is medial. So they're kind of angled like this on the body, okay? So because of that, when I say, if I'm like that, when I say, this is looking for the back now of the body, right? When I say I do a lateral or like a side bend to the set, if I do a lateral bend, like I go like this, that does this. So that motion is allowed. You can see it kind of slides with that, right? If I try to flex forward, if I look from the side, if I flex forward and do like forward flexion like this, and go forward, so that would be this, right? If I go forward like that, you can see these joints here, that guy, it allows that motion, right? If I try to extend, it allows some of that, yeah, because it slides and glides with it. But if I try to rotate, look at it hits. See how they hit? Right there. So the inferior articular process of this above one, the superior vertebrae and the inferior vertebrae, they hit. So no rotation. So in the lumbar spine, there's very little rotation. When you do this, that rotation is not happening in the lumbar. It's happening mostly in the thoracic. Well, entirely in the thoracic. So there's a little bit of motion. And cumulatively between all 5 lumbar vertebrae, there's a little bit of rotation and motion, but not much. Okay? So that's the lumbar. If we go to the thoracic, say we'll grab 2 thoracic here. This is kind of mid-thoracic, maybe T7 or 8. Here are 2 of those. Looks like a giraffe head. Isn't that cool? Okay. We used to say that in school all the time, giraffe head. So this is from the posterior view. So spinous processes, you can see how angled down they are, right? That's that rule of 3. I have a video about the rule of 3 if you're wondering about that. I won't say the whole like cliche. It's linked below because it's not. But if you search it, you'll see it. There's like 5 videos. So the facet joints here are there. You can see. Okay, and from the back, you can see the flat surface is here. It's like the ears in a giraffe, right? So there, and then behind or inside that one there. Okay, sorry, this is not ideal, but works pretty good. Hopefully it makes sense. So because they're like that, what motion's allowed? If I rotate, is that motion allowed? Oh yeah, look at that. It slides right over top. It's almost like it's doing this. It's like it's doing this. As I rotate, say to the right, that happens, right? As I do this and rotate, it's like that facet is sliding along, okay? So it allows that motion. If I try to, say, extend, does it allow extension? Those 2 are stuck. Sorry, bad preparation here. There we go. Those 2 are stuck. So you can see the facets there. If I try to extend, they hit. So it doesn't allow extension. So in the thoracic spine, there's not much extension. And that's why, because the facets hit. And also the ribs are in the way, and there's a lot of reasons, but they hit. Okay? If I try to do flexion, yeah, that works. They just separate. But there's also ribs in the way, right? So our thoracic, when we try to flex forward, we can do thoracic flexion a little bit. Obviously, from that allows it to do that motion. But because of the ribs, there's not a lot of, the ribs get in the way, right? So you have these ribs around the front. So if I try to flex forward, the one rib just does this and they compress, right? So you have a little less motion there in terms of flexion extension. That's why the lumbar and the cervical is mostly that, right? So rotation is the big one in the thoracic. But these facet joints, the question on your test will probably be what direction did the thoracic facet, articular facet joints face? And these ones would face, as you can see on here, this one faces posteriorly, right? And the one above faces anteriorly. You can kind of see it there, right? This guy and that guy, right? So they face anterior posteriorly versus in the lumbar, they're medial lateral. Okay, quickly go to the cervical. This video is getting long. So let's look at two of these guys quick. These ones are a little more complicated in terms of the motion because the angle's it's not quite as direct. But again, you have the bodies in the middle, and then here are the facet joints. So you can see that guy and that guy articulating with those two. So it's the same thing. The ones above articulate with the ones below the one above. Okay, so it's like these two articulate with each other. See right there. And this whole bump is called the articular process, by the way. And then the flat face is the facet on the process, just if you see that in your test. Okay, so these ones are facing they're almost facing, if you can imagine, if I was like with my back to you, they'd be almost like this. Okay, so if you imagine one above it like this, if I rotate to the left, to the right, it's going to do this. Or to the left, you can do this. So they slide and glide on each other like that. So what's allowed is like rotation. So think of what you can do in your neck, everything, right? So rotation, they do this. Lateral flexion, they kind of do that, right? If I do this. And then extension, yeah, they can do that. They can extend back, right? If I extend back, right, these are the bumps in the back of your spine. So this is the posterior part here. As I extend back, that allows that. As I rotate, it allows that motion. As I lateral flex, it kind of allows that. But there are these other processes called uncinate. It's more on this. Uncinate processes are here limiting some motion, but that's a different video. But if you see something about uncinate, UCI-NATE, uncinate processes, that's limits some motion as well. But yeah, so all three are really allowed in the thoracic, which is why you can do everything with your neck. Which is also why, though, in anatomy, a central concept, I'll end with this, a central concept is that increased mobility equals decreased stability. Increased mobility equals decreased stability. So because of all this extra motion that's allowed in the cervical spine, where do you have a lot of issues a lot of times in our bodies? Is in our cervical spine, right? Neck impingements, headaches, impingements of nerves, right? You can get degeneration of the discs. There's all these different things that can happen, right? And one of the reasons why is a ton of mobility. Our shoulders, ball and socket joint, ton of mobility. What do you have a lot of? Shoulder dislocations, shoulder injuries, all these various things in our shoulder. So our hip the same way. So the more stable a joint is, the less issue there is. But the spine, to allow us to do everything we need to do, has to have a lot of mobility, but also leads to a lot of dysfunction potentially too. Opens up the door to it. Okay, those are facet joints. Hope that helps.